Good afternoon, everybody, and welcome at the webinar of PEROSH, which is on a project that we closed not so long ago. It's called the Lessons Learned from the Pandemic. We will present to you the results of this project. Several countries made their national country reports, and there was an overall report based on these national reports. These reports will be introduced briefly by Robert Lung from Sweden, who was the project coordinator. And for all of you attending, you can also download all these reports, the overarching report and the national reports from the PEROSH website. Please have a look at the PEROSH website and scroll in our news feed. And every now and then you will see a message that pops up with the country report from the Netherlands, from Poland, from Austria, whatever. Welcome again. A few household rules. All of you who attend currently, we have 70 participants in this webinar. Your cameras are switched off and your audio is switched off, but when you have a remark or a question, please use the Q&A and we will see to it that this question will be answered. For the rest, this event, this webinar is being video recorded. So after the recording is ready, this takes 1 hour, maybe 2 hours after the event, you will receive an email with a link to the video, and you can have a look at the video recording of this webinar. I will give the floor now to Robert Lung, who will present to us the report, the project. He will give a brief introduction to the project, and then we will go on to a panel discussion with some country representatives being present. Robert, can I?
Thank you. Thank you. I will start with to share my screen here. And my first question is, do you see my screen now, the presentation?
Yes, we can see it, so you can continue.
Perfect. Thank you. And hi, everybody. And it's a pleasure for me to present this report because it has been a huge effort for me and a lot of people in this room.
Robert, I'm afraid I cannot hear you.
You can't hear me?
I cannot hear you.
Do you hear me now?
I can hear you just well.
Yes, I can hear you too, Robert.
Oh.
Yeah, I can hear Robert.
Perfect. Perfect. Then I continue. I will start to talk about a little bit about these lessons learned, how different European countries addressed occupational health and safety challenges during the COVID-19 pandemic. And this is a project that has been, what's happening now? I can't switch page. No, perfect. This is a European project with 7 countries that has been cooperating. And it's Austria, France, Germany, the Netherlands, Poland, Sweden, and United Kingdom that has worked with this project for at least 2.5 years. And it is a very, very interesting project, not just for the project, it's for the future as well, I would say. So the introduction to this presentation, you can say that COVID-19 was not only a health crisis, it was also a major challenge affecting the economy, all the institutions, and all workplaces all over the world. And the purpose with this report was to analyze workplace safety and infection control during the pandemic. The focus was especially on occupational safety and health. That means roughly that how the workers were protected and how risks were managed and how the workplaces adapt to the virus. We don't go far into the broader public health measures in society. And as Jean-Michel mentioned, this is a report developed through collaboration between the PEROSH members. And you see on the page, you can see on your screen the report that is just a small part of the project. This is a combined report, but behind this, it's 7 national reports which has analyzed how the measures were done and the outcome from them in these 7 countries. So it's a small part of the project that I will present today. Interesting things that we find was that every country has their own context. There are different contexts between the countries, the different conditions even before the pandemic came. We have different governance systems and also access to data, which means that the experience were not identical in all these countries. But using a comparative approach made it possible to identify common patterns for us, national differences, and also shared lessons. And if we just go back in time and think of how it was when the COVID-19 actually came into Europe, we need to remember that we didn't know much about this virus. It was a great uncertainty because the knowledge about the virus was so limited. But very quick, the workplaces became key locations, both for potential infection risks and for protective actions. Essential sectors such as healthcare, transport, retails, and public services had to continue their operations, while many office-based sectors shifted to remote work. That was something that happened quite fast. And as a result, the occupational safety and health became an important part for the overall infection control strategy in the countries. When we made this report, we divided into 5 areas, and the social context at the onset of the pandemic was one of them. It was how we were organized and how we initially responded to the pandemic. And also the workplace measures. What actions did the authorities and institutions introduce and also how it worked. If it worked out well, and some of them actually didn't work. And finally, and in my opinion, the most important is the lessons learned, which we can actually use in the future or have use of. These 5 areas helped us to structure and analyze and compare experiences across countries. And the central question was not only how countries reacted, but how we can improve through future preparedness, resilience, and cooperation in working life. So if we look at for example, the social context, so the national responses varied significantly. Some countries introduced lockdowns, while others just relied on recommendations and voluntary compliance. This was a huge difference between countries we saw in the report. Responsibilities were also divided differently, depending on whether systems were centralized or decentralized. And if we look at the workplace level, common measures included hygiene routines, personal protective equipment, and remote work were possible to set up. And actually, we can see measures from the pandemic that is still alive in our society today. You can think of the remote work that has almost exploded, even the digitalization that is accelerating a lot. But the most interesting is that it is a stronger integration of occupational health, safety and health issues into crisis planning, which is interesting for the future. So if we look at the lessons that we actually learned from this crisis, was that the preparedness and flexibility are essential. Organizations that could adapt quickly managed the crisis better, and we have seen a lot of that when you look into the national reports. The connection between occupational safety and infection control became much clearer, and the workplace health must be a part of the national emergency planning. And it also shows us that it's a strong need for international knowledge sharing. Countries can learn from each other. Both success and mistakes can be of interest when it comes to a crisis like this. So, and finally, these lessons should not just be for pandemics. It could be other crises as well, where we can use these kind of measures. And we can see it actually in Sweden today, that it happens now and then that the government goes out and recommend people to work from home due to like weather conditions or such. This is my last slide of this presentation before we go into the questions, and all of the experts can tell you much more about this. But I can say that you see here the name of organizations, countries, and experts that has been very important for this project. They have contributed to the report, and I would say that this report was just possible through cooperation between researchers and between organizations and countries. It also demonstrates the value of collaboration across borders when addressing shared challenges. So if I should conclude this report and this project, I would say that the COVID-19 pandemic showed how essential occupational safety and health is for keeping society functioning during crisis. Although countries use different approaches, many of the challenges were shared. And the strongest lessons are the importance of preparedness, cooperation, and the ability to adapt quickly. And in this work, I personally can see that PEROSH can continue to play a great role and be a knowledge hub and strategic support for Europe in future emergencies. So thank you very much for listening. This was just a brief presentation of the report, and I hope that the experts now during the panel discussion can get even deeper in it. So thank you very much. I will stop sharing now.
Thank you very much, Robert. And I would suggest to everyone to download the report, where you saw the slide with the cover of this report, Lessons Learned from the Pandemic. It's a great report. And there you can find tons of information on how Europe dealt with this crisis. And indeed, within PEROSH, it was a great collaboration. Also, this project after the pandemic, but during the pandemic, we also collaborated intensively with PEROSH partners on selecting the best protective equipment. You may remember that we had all these filters and air measurements. There was a lot of panic and chaos in the beginning of the pandemic, and then PEROSH tried to get some organization in this mess to give standards for testing of mouth masks, for instance, and what is the best quality to use. So thanks a lot, Robert. And this time we will continue with a panel discussion, and we have quite a few of those experts that Robert showed in his last slide on board. We have Robert himself, of course. He is representing Sweden, but we also have Małgorzata Okrasa from Poland, from the Polish Institute, which is also a member of PEROSH. We have Clemens Dobusz from Austria. He is representing Alpha, which is also a PEROSH member. We have Karin Rossignol and Manon from the French Institute, representing France. We have Svanjo Robelski and Claudia from Germany. They are from BAWA, which is the federal agency in Germany on health and safety at work. And finally, we have Yigung Shen on board, who is representing the United Kingdom, and she works at the Health and Safety Executive in the UK. You can have a look at the webinar program. Most of you have seen the bios of these speakers to learn more about their backgrounds. I am looking, Ninetta, at perhaps the chat or the Q&A. Do we have already some questions? Not really.
No, we don't have. I just posted the link from the PEROSH website where all the reports are available.
Yeah, I see it. Excellent.
So
that's really good.
If any one of the participants want to raise their questions, they're free to do it either in the chat room or in the Q&A session.
Yeah, Please do. Then I will start with a statement and ask our experts who are here to respond on this. And it's a free discussion. You know, it's up to you to respond to it. And if a specific country is not active enough, or we haven't heard enough from a specific country, I will ask you, please, how is the situation in your country? Maybe first a remark on the preparedness and the resilience of OSH systems. Robert said a few words on that. And you could say that one of the clearest lessons from the pandemic is that preparedness on paper does not always translate into preparedness in practice. So the question is, where did our OSH systems prove resilient, and where did they show critical fragilities? Who would like to respond to this statement question on behalf of their country? Poland. Małgorzata from Poland, please.
Yeah, why not? So in Poland, I think one of the strongest lessons was that indeed that legal responsibility for OSH was very clearly defined, but practical preparedness for a biological crisis of such scale was very limited. Employers were obliged under the labor code to assess occupational risk and also implement preventive measures, but in many most workplaces, we had the situation where employers were not prepared for such sudden and very large scale hazard like SARS-CoV-2. In early stages, we had shortages of PPE, like in many other countries, especially in healthcare, and also very, as you said previously, limited testing capacity because everyone wanted to test everything immediately. And we also had insufficient emergency stockpiles, which was the serious gap in the system. At the same time, resilience was visible in some cases in how quick the workplaces adapted to the situation. Employers very rapidly introduced distancing rules, redesigned workplaces, staggered shifts, sanitation protocols were implemented. We had visitor restrictions, and also remote work was introduced. What was particularly important was the example of healthcare sector, where hospitals were rapidly transformed into dedicated COVID facilities, like in many other countries. And this helped a lot to respond to the crisis, but also caused underutilization of other services. And that was also a gap in the system that we have.
Fragility,
during the COVID. And I think that is most visible fragility of the of what we have seen.
Overburden of the healthcare system due to the pandemic. Okay, thanks a lot. That's a very honest answer and quite interesting. Yikun, you have your hand raised from the UK, United Kingdom. What can you say about where it proved resilient and where you had fragilities?
Yeah, I think in the UK situations, we have quite a good science base. And also we have a quite a good regulatory system. However, the pandemic is so different from anything that we can anticipate. Particularly, people think that lockdown is necessary. We have the first lockdown, just like other countries. But people will not understand that the economy still need to keep going. The business still need to keep going. The workers still go to work, even during the lockdown. Like in 2000, 2020, we have 30% of workers have to travel to work during the lockdown. It increased to 50% in 2021, but still quite significant. So in that situations, workplace, as Robert explained, is quite important locations for infection control. But in traditional occupational health and safety, infections risk assessment and control is not part of regular occupational health and safety assessment. So it was quite a steep curve for the employer to really understand how to do the risk assessment. So that's the weakness. Another weakness is about, I don't know about other countries, in the UK is the top-down system that led by Public Health England, later UKHSA, UK Health Security Agency, working with local public health directors, and HSE as a regulator for workplace health and safety were only brought in if they consider if the outbreak significantly contributed by the workplace conditions. However, those organizations are not normally working closely together before the pandemic.
Yeah.
So I think about the collaborations also make a big challenge. So I think UK has quite a good resilience, but we're also facing a significant challenge. But most of all, the most significant challenge is about inequality that is already shown before the pandemic, and it become intensified during the pandemic. For example, at the beginning, that statistics have shown the high mortality and infection rate in certain ethnicity and occupation, the combine of it, and also in related to the social economic background where they live, and those kind of things is not health and safety regulator can deal with on its own.
No.
Have to working with public health, working together. So I think that's really the challenge that we need to consider moving forward.
Yeah.
Thank you.
Thank you, Yigun. Really interesting reflection on what happened in the UK indeed. Is there anyone else who wants to respond to this first question? What proved resilient in your countries and what was really a challenge? Okay, then I see Clemens. Yeah, and then Swantje, then you. Clemens raised his hand first. So.
Just a real short statement, because if we look at Austria specifically, one important insight that was made is that we did have strong institutions like the Labor Inspectorate, but the OSH system was not always structurally embedded in early crisis decision-making. So we had the GECKO Commission, which was a national interdisciplinary COVID-19 crisis coordination body. And that was a step in the right direction. But this commission was established to support evidence-based decision-making, but later on, not just in the beginning. So we needed to include OSH expertise early and systematically. We didn't do that.
Yeah. Okay, thank you. Swantje, then from Germany.
Yes, thank you. I would also support the aspect of cooperation between public health agency and OSH agencies, but I think in Germany we have a highly formalized OSH system. We have the dualism, and it's kind of complex. But I think this also gave us a good base, a good foundation to work on, and all the stakeholders worked closely together and relatively fast. And I think that was a good first response. And we also had some expert committees who provided us first insights, or were able to connect the challenges of the virus to previous or to knowledge based on other dangers and hazards. So we could build on that. But generally, the very different responses, also with the time and with the progress of the pandemic, were difficult. And maybe another aspect that has not been mentioned yet is the state of digitalization, which was a little lower in Germany than maybe in some other countries, and that was that was a challenge, and there we had some work to do.
Yeah. It formed a sort of threshold for introducing remote work, probably.
Yes, that on the one hand, and on the other hand, for agencies and for institutions to work together, for example, for tracking contact information from people who were infected and all these aspects.
Mm-hmm. Yeah, I see. Okay, then many of the measures introduced during the pandemic were initially seen as temporary. Yet some of them have permanently changed how work is organized. Remote work, for instance, so we will come to that later. And to your opinion, which of these changes should we actively keep and which should we critically reevaluate, so to say? Is there someone who could respond on that, please? So are there any changes we should keep? Or are there some we should evaluate again? Yikun?
Yeah, I'm happy to
United
start.
Kingdom? Yeah.
Yeah, I'm happy to start to answer this question. So the first things that surprised us is at the beginning, people didn't appreciate the importance of ventilation in reduced transmission, and gradually become more and more important in controlling the transmission in the workplace. And particularly for mechanical ventilations in the workplace. And people do not have enough knowledge or maintenance, because unlike face mask or washing hands, you can feel, you can touch, you can see, but ventilation is something that you can't see, you can't feel. And it's difficult to really change a ventilation system, air filtration system during the pandemic. However, in the UK, it become an important issue that for future building design consideration, because this is not just about the COVID-19 pandemic. It's also about future pathogens, infections
that might arise.
Yes, so I think it become quite important for consideration. But in my view about remote working, it become a new norm, new normal. However, we don't really have the evidence about what is the most effective a model of remote working or hybrid working. And it also continue to intensify the inequality, because the people in a better social circumstance may afford to work from home more than the others. And that's continue on from pandemics to the peacetime. So I think that's something we really need to evaluate.
Yeah.
Thank you.
Yeah, thanks a lot. Really very useful comments. Anyone who wants to reflect on that from the other countries? Do you recognize this, or is there some distinctive difference in your countries? So what should we actively keep and what should we rethink? Robert, in Sweden?
Yeah, in Sweden, I can see a quite big difference when it comes to this remote work. And it's not just remote work itself, it has been like a part of the job. And there are people that would never ever take a job at a company that you don't have the possibility to work from home and so on. So it has been a part in the same way as a salary or vacation days and so on. It's some kind of conditions for the position, and that's quite interesting, I think, and it's something that I'm pretty sure will stay.
Yeah, quite correct indeed. Yeah, Clemens from Austria.
Yes, I would agree with Robert. I would say some of the most interesting developments are the ones we didn't plan, actually, especially remote work and digitalization. Those are not temporary anymore. There are structural changes in how we work. So that at the time when our PEROSH research group started, was not so obvious than it is now that those changes are here to stay. So I think we should keep the flexibility and the digital tools that proved useful, but critically reevaluate the health and organizational consequences, especially ergonomics, psychosocial risks, and the blurred boundaries between work and private life that emerged.
Yeah, absolutely. And it's good that you mentioned this last issue, because some of our members, TNO and others, have done already quite some additional research on this blurred boundaries, because remote work indeed in many of our countries is there to stay, but what are the advantages? Clearly, but also there are some disadvantages to this work organization. We have a few remarks in the chats and the Q&A. Someone agrees fully with that the pandemic showed the importance of professionals working together, both from public health side and occupational health side. So that is true. I think Yigun, you introduced this issue. I think we saw it in many of our countries. Another one makes a remark that one of the difficulties from the pandemic is the contact tracing, which was a big issue. Not really prepared for that, lack of capacity. I remember also in the Netherlands, where I come from, this was really an issue, how to come to grips when the pandemic exploded, to this contact tracing. Could any one of you respond to that? Do you recognize this, or I see that Yigun, you raised your hand. Yigun, please.
Yeah, I'm happy to also start the conversation for this. Contact tracing evidence shows that the national level organized contact tracings may not be effective, but localized contact tracing based on local situations can be critical for workplaces. For example, if there is a huge a rise in community infections around the workplace or where the worker live, it is good for the workplace to have a contact tracing local contact tracing in place to reduce the transmission risk and outbreak risk. So I think in my experience, that contact tracing at a local level with guiding by epidemiological data will be effective.
Yeah, correct. Anyone else who wants to reflect on that? I know, at least in my country, the Netherlands, again, there was quite some budget reserved for an increased resilience, for future pandemics. One of them was this contact tracing, because you also need staff for it to process all this and to check. But now there are already budget cuts on this specific pandemic preparedness budget, as you may call it, and there's a lot of criticism on it. Why are you scaling down when we might have a future pandemic? Think of the bird flu, which is spreading around. And when this jumps to human beings, we are in deep trouble. So indeed, this contact tracing really consumed a lot of manpower in our health systems. There is one remark from Dr. Ferenc. He says that, let me emphasize that the work that occupational health services, occupational medicine specialists and nurses, either internal or external, have done during the pandemic. Besides traditional medical activities like testing and immunization, they helped companies to translate public health messages to the shop floor level measures, and thus protecting workers' health and contributing to business continuity. I think that's true. It also showed how occupational health services really could play a distinctive role in assisting employers and workers to deal with the pandemic. Yeah. Okay, do we have any more remarks? I see a long remark here. We will come back to this later if we have the possibility. Let me introduce a new statement. We already discussed this remote work, which proved essential in many of our countries for continuity due to the economic challenges, of course. Also, the economy was bound to continue. But it also exposed inequalities, indeed, for those who are digital savvy and those who are not, and those who can afford to have a laptop and other stuff, and those who cannot. New risks and also blind spots in prevention. And we can all agree, I would say, that remote work is here to stay in many of our countries in specific structures and procedures. But have we truly updated our OSH thinking to match this new reality of work? Who would like to comment on this? Swantje, maybe you? And then Robert.
Yes, thank you. I think we're still in the process of really getting the grasp of all the things we have to consider. Before the pandemic in Germany, working from home or remote work was oftentimes kind of reserved for some or a minority of persons working in some upper management functions. And the pandemic was the first time that really, on a broad scale, people were working from home. And so it was also for us the first chance to get more data and get more experiences on these aspects. And I think we're still working on, understanding all the relations and all the possible aspects also regarding mental health. I think this was also mentioned in the chat of how do we experience work as a social environment, how do we work together, hybrid and digitally, and I think there's still many questions we need to answer to really understand and use it as a
changed
as a
the
tool.
world of work. Yeah, I agree. Robert, in Sweden. From Sweden.
Yes,
in Sweden.
In Sweden, I would like to say something quite similar to Swansea here. First of all, this development has gone extremely fast. When the pandemic started, I worked at the university. I had never ever heard about Zoom or Teams or something like that, and 3 weeks later, I was at home working with Zoom, hold all my presentations and lectures on Zoom and so on. So it was very, very fast. And nowadays, we work with Zoom or Teams almost every day. So it's a huge shift in the workplace. It's also something which comes up in this chat here when it talks about mental health. It could be something, even though we think it's good, it's not always true that it is good for us. So for all of us in this room or in this panel that works with OSH issues, I would say it's very, very important that we keep on monitoring what's happening with this increasingly high and still increasing number of people working from home. So I would like to stress that we need to monitor this, measure it, and see what's happening because it's a very, very fast change we see.
Yeah. it was really a steep learning curve for us all. I think also for organizations. You're absolutely right. Yeah. Okay, thanks a lot. More and more remarks are coming in the chat. I see a comment of Alan Baswick. Great to have you here, Alan. That in the UK, also these regular meetings between several technical advisory groups and public health and occupational health worked quite fine. He's very positive about it. Please read it, and also a link is provided to a report. We see a remark from Ravinda Ganesh. Following the pandemic, organizations need to make sure that they include preparedness for future pandemics from biological agents in their business continuity plans. I fully agree. With the increase in zoonotic agents as a result of urbanization, pandemics may come around a lot sooner than we think. Yeah. Okay, let's have a short discussion on communication, trust, and worker involvement across countries. Trust and communication emerged as decisive factors. Where workers trusted institutions and felt involved, measures were more effective. So how do we translate this insight into future crisis governance when it comes to trust? Can reflect on this. Małgorzata, you from Poland, please.
Yeah, I wanted to say something about that because in Poland, trust and communication had a huge, really huge influence on the compliance of the workers. So where employees trusted management and felt informed, compliance with preventive measures were much stronger than in other cases. Our report showed that employees who positively assessed their managers reported better job satisfaction, stronger stability, and better mental well-being during all of the pandemic time period. Communication and also what was really highlighted, supportive leadership within the organization improved resilience, and it was shown in many research papers. At the national level, however, trust was very fragile. Public surveys showed that 58%, which is a huge number, of the responders described the government's handling of the crisis as unfair and incompetent, and sometimes even undemocratic, which was very surprising. Misinformation and it was weird. Conspiracy theories also weakened the compliance. For example, many people questioned mask effectiveness or vaccine safety, and some even viewed the pandemic as artificial information panic. And this showed that in the future, in my opinion, crisis governance must include very transparent communication and very reliable information that would be evidence-based and very strongly supported by the research. And I think that active worker involvement in this case is very important also.
Yeah. Thank you. Thank you very much for this answer. Jeroen, from the United Kingdom, what can you say about this trust and communication, worker involvement?
Yeah, thank you. So actually, communication engagement is always very challenging, especially during a pandemic. The message, the guidance are changing so frequently as the evidence emerged. And I think it's quite important to communicate not just what people need to do as the guidance and also the evidence behind it. And I think during the pandemic in the UK, the scientists has quite a good reputation because they actually gain a lot of trust from the population. And I think we need to build on that. However, I think Margarita did highlight the issue that personally I'm quite worried about, because while we are thinking of different way of communications to get reach to people. But at the same time, there's a lot of fake news, a different social media. What I worry about is if the next pandemic comes, whatever the pandemic will be, who will be controlling the social media? And how can we prevent the fake news? Because if we can't control the fake news, no matter how much you put efforts into the communications, you will not build the trust and change behavior.
Yeah. Absolutely true. Absolutely true. Okay. We have quite some remarks in the Q&A and also in the chat, underlining some of the points we raised during our discussions. I see a remark from Kostas, our respected colleague from Elinye in Greece, who says that, okay, we immediately published occupational guides when the pandemic broke out, underlining the importance for good ventilation practices, as Yigun, you introduced. This was a sort of awareness that came later, the small droplets, ventilation issues. And Kostas also provides a link to these guidelines in English even, I think, not only in Greek, but also in English. So that's really a good remark. So we still have a bit less than 10 minutes. Let's look to the future. So beyond the pandemics, a broader crisis preparedness. This was also in our introductory text of this webinar, and I think also, Robert, you raised it a bit, the importance of these lessons learned. Sometimes when you talk about the pandemic, some people really get bored, God, this was years behind us, I don't want to hear about it anymore. Yeah, this may be true, but we can also draw some lessons for future crises. So several of you stressed that these lessons go far beyond pandemics, for instance, to environmental disasters or infrastructure failures. We live in a challenging geopolitical time, you could say, geopolitical crisis. So which lessons are then truly universal if we think of the future and preparedness? Can anyone of you reflect on that, please? Yigun, yes.
I think data is quite important, even though it's very basic. I think data for all of the country. For example, when the pandemic started in early stage, as I explained, there is a high risk identified in certain ethnicity and occupation, and then people just realize that the ethnicity data and occupational data are not consistently collected at a national level or in a sufficient quality. That will affect.
Makes you blind.
Yeah, that will affect how we identified the high-risk population and also the vulnerable population. And I think it's always a very uphill struggle to make sure that the information about occupation, people's job and workplaces are collected at the national level so we can link data set with health, so we can understand the high-risk population to protect those vulnerable population. And that's the first thing is universal. Another thing I think is quite universal is about system thinking, because the pandemic shows us it's not individual risk factor. It's a very broad. For example, the transmission in the workplace, it affected by the working conditions, work environments, as well as where people live, how they travel to work, and their social background. And the transmission, there's no boundary, between community and workplace. If we're going to respond to future pandemics, we need to develop this thinking that is a whole system approach.
Yeah. Very good remarks indeed. Yeah, you're quite right. Anyone else who wants to respond to this? So which lessons are really universal so that we are prepared for a future emergency or crisis? Malgorzata, you want to say something, but you are muted.
Oh, sorry.
Yeah.
I just wanted to quickly add something to what Eugen said. Information is very important, but it also is very scattered. Even if we have the information somewhere in the system, it is not usually very well structured. So I think that this structurization of the information is very important, but also accessibility, because we as OSH managers don't usually have all of the information that is somewhere in the system.
Yeah.
That was my remark. Thank you.
Yeah, true. It's scattered. Yeah. And Robert, you also had a remark.
Yes, I think that it's the general work with OSH issues that is key to all crises or everything that happens. If you have a good job and you continue to work, it always you are much better prepared whatever crisis that happens. In Sweden, we didn't have any lockdown at all. And even the schools were open and the kindergartens were open. Everything was open during the whole pandemic.
Yeah.
And we made an study on schools, especially on schools and teachers. And in that study, we saw that schools that had this continuous work with systematically work with OSH issues, they didn't actually prepared for a virus, but the work itself, that they were prepared and they could shift and adapt much faster, and those schools were much more what do you say, had a greater success than others. So I think that the continuous work with OSH issues on a strategic level is something that could help us during all crises, not just a virus.
Yeah. Thank you very much. Yeah. From Germany or Austria, some additional remarks in this respect?
Yes, I would agree to what Robert said, absolutely. Of course, if a company or an establishment does not have any OSH structures, they are less prepared. And also in terms of risk assessment, if there's a risk assessment, you can build on it and you can adapt it to different aspects. But if you have to start all this work from scratch, thinking first about, oh my gosh, what do I have? What is my work organization and what are my tools and who are my customers or whatever? And that's the first time you start to think about risks and all these aspects related to it. It's harder, and I guess you're less prepared. So kind of our hope was that occupational health and safety would remain a little more in the spotlight also after the pandemic. But I think those hopes have not been quite fulfilled.
Not come true.
Not come true. But we're on the way, and I think that many countries, or not many countries, many companies took some steps, and maybe now they are have a better foundation to build on.
Yeah. Okay, thank you. We need to close down. We are almost done in our time. I would like to refer to another interesting remark from Alan Beswick from the UK, where he's quite positive about the broad access to newly published research, which was disseminated quite quickly during the pandemic. So that is good. I think there was one question left in the Q&A when we were talking about all the remote work. Someone is asking the questions Do some of our nations, our countries, have seen an increase in musculoskeletal disorders issues due to all this screen time? Is there any one of you who can give a quick answer to that before we close this webinar? Is there indeed valid increase in musculoskeletal disorders because of all this extra remote work and screen, or is it a bit too early to say that? Okay, no remark. You haven't seen it. Okay. Okay, then I would like to thank the team of the Lessons Learned from the Pandemic project, which is now officially closed. It was already closed with all the reports, but this webinar was one of the dissemination activities. Thank you, Robert. Thank you, Yigun, Malgozata, all the team colleagues here. It was a really nice discussion, I think we had. To all those who participated, check your email because you will get a message when the video is ready. Have a look at our website for all the reports, also the country reports, which you can download freely. And if you want to be on the list for upcoming events of PEROSH, you should subscribe to our newsletter, and this will pop up when you visit our website. So thanks a lot, and hope to see you next time. Thanks, everybody. Bye.
Thank you. Bye-bye.
Thank you.